Concept of disabilities and inclusion. Introduction to the module. Disability is a vital component of a diverse society. An inclusive workplace recognizes all employees' strengths. It provides employees with disabilities, whether visible or invisible, with an equal opportunity to succeed, learn, be fairly compensated, and advance. True inclusion involves embracing difference. This module discusses the concept of disabilities, types, causes as well as barriers to inclusion. Learning objectives. At the end of this module, you will be able to understand the concept of disability, identify various forms of disability as well as their causes, recognize the concept of inclusion and the barriers to inclusion in the workplace, define the concept of ableism and its types, know the importance of disability inclusion in the workplace. Definition of disability. Disability can be defined in one of the following ways. It is a limitation or lack of ability, resulting from an impairment, to perform an activity in the manner or within the range considered normal for a human being. It is a condition that severely restricts one or more major living activities. It is a physical or mental impairment that limits or restricts the condition, manner, or duration in which a typical person in a population may do a major activity. It is a physiological, emotional, mental, or behavioral issue that will necessitate ongoing help and care. Types of disability. There are three traditional disabilities commonly referred to as sensory disabilities. Intellectual disability, hearing impairment, visual impairment. However, there are many other disabilities, including social, emotional and behavior disorder, autism spectrum disorders, physical disability, learning disability or difficulties or disorders. They are discussed below. Intellectual disability. A person with intellectual disability, ID, has significantly lower intellectual functioning or reasoning power than the average person of the same chronological age, peers, and also lacks abilities in adaptive behavior related to daily living tasks, for example, independence with daily living, bathing, brushing the teeth, buttoning a shirt, tying a shoelace, etc. Hearing impairment. Hearing impairment is defined as the inability to hear any sound from one or both ears. The impairment level can be minor, moderate, severe, or profound. There are two types of hearing loss. Conductive hearing loss or impairment. It occurs in the outer or middle ear when something interferes with the transmission of sound from the outer to the inner ear. Sensory neural hearing loss. This is due to an inner ear condition, damage to the pathway from the inner ear to the auditory nerve, and occasionally the hearing nerve, which connects the ear to the brain. This sort of hearing issue is frequently permanent and affects the person's ability to hear some frequencies more than others. Visual impairment. Visual impairment means the inability of a person to perceive light. There are three different types of visual impairment. Partially sighted. This is due to a type of visual problem that has necessitated the requirement for special education, the provision of technology or intervention to allow the person to function. Low vision. This is referred to as a severe visual impairment and does not only affect distance vision. This category includes all those with vision difficulties who, even with glasses, are unable to read print or pictures in a book at a typical reading distance. Totally blind. Individuals have no residual vision and a total lack of perception of both types of light. Social, emotional and behavioral disorders, SCBD. Social emotional behavioral disorders, SCBD, refer to a broad range of emotional issues. It is an umbrella term for a variety of complicated problems, including emotional difficulties and complex mental health disorders. These can include, among other things, adjustment disorders, anxiety disorders, and obsessive-compulsive disorder, OCD. Autism spectrum disorders, OSD. Autism spectrum disorder, OSD, is a complicated neurobiological developmental condition that lasts for the rest of a person's life. It is also known as a developmental disability because it usually begins before the age of 3. It creates delays or difficulty in a wide range of skill areas. Physical disability. Cerebral palsy, sometimes known as CP, is one of the most common physical disabilities. Birth abnormalities and limb deficiency are two other examples. Cerebral palsy, CP, is a physical disorder that affects muscle coordination and mobility. The terms cerebral palsy and palsy refer to muscle weakness or inadequate control. The severity of CP can range from mild to severe. It may be present at birth but is not passed down from parents. It is possible to be born with it. CP is a chronic illness, and while symptoms may alter over time, they generally do not worsen. CP is usually caused by damage to the portion of the brain that controls muscles and movement. Brain injury can develop during the mother's pregnancy or during childbirth. Learning disabilities or difficulties or disorders. Learning disabilities impair a person's ability to learn, retain, and process information. Some people with LD struggle to listen, speak, read, write, and do maths. They struggle to learn and absorb knowledge provided by standard classroom methods. There are various kinds of learning disabilities. They include dyslexia, difficulty with reading and spelling; dyscalculia, difficulty with maths; dysgraphia, difficulty writing and forming letters. Causes of disabilities. Disability can be linked to 3 distinct stages of human development. Prenatal. Prenatal causes of disabilities refer to factors that affect the fetus before birth, such as genetic abnormalities, infections, exposure to toxins, or insufficient nutrition during pregnancy. Perinatal. Perinatal causes of disabilities occur during the birth process and include birth injuries or lack of oxygen to the brain, resulting in cerebral palsy, intellectual disabilities, etc. Postnatal. Postnatal causes of disabilities are those that occur after birth, such as infections, brain injuries, or exposure to toxins, which can result in developmental delays or disabilities. Defining inclusion. Inclusion is regarded as a fundamental human right. The goal of inclusion is to accept all people, regardless of color, gender, disability, medical condition, or other need. It is about providing equal access and opportunity, as well as eliminating discrimination and intolerance, removal of barriers. It has an impact on all elements of public life. Barriers to inclusion. The barriers to inclusion are: biases in the hiring process. When it comes to seeking work, people with disabilities have much greater challenges than people without disabilities. Hiring managers, who are often unaware of their unconscious biases, tend to be pessimistic about the work abilities of candidates with disabilities, regardless of their qualifications. Fear of negative judgment and repercussions. When new employees with disabilities enter the workforce, they sometimes face several worries. For beginners, there's the everyday fear of being mocked, underestimated, and othered by co-workers who may contain an implicit bias against people with disabilities. On top of that, many are concerned that their disability status will have an impact on high-stakes circumstances such as performance reviews and promotions. Lack of accessibility in workplaces. Accessibility barriers persist throughout the job life cycle, from hiring to performance reviews. Many electronic job boards and firm websites, for example, offer poor digital accessibility features, excluding those who have eyesight difficulties, limited mobility functions, and so on. Concept of ableism. Ableism is discrimination against people with disabilities. Discrimination can be intentional or unintentional, and it is based on the belief that there is a right method for bodies and minds to function and that anyone who deviates from that is inferior. Ableism is usually broken down into one of 2 types, physical and mental. Physical ableism. This type of ableism is characterized by the deliberate or unintentional discrimination of people with physical disabilities. These forms of discrimination, however, may go unnoticed by people who are not disabled. That's because when you don't have to consider how others are functioning, you're less likely to notice how infrequently disabled people are considered in the design of public spaces. Mental ableism. Mental ableism, like physical ableism, is intentional or unintentional prejudice against people who are mentally sick, neurodivergent, and categorized as having developmental impairments. Disability inclusion. Disability inclusion entails creating an inclusive workplace where people feel welcome and comfortable and where they are seen, valued, and appreciated for their contributions, not in spite of their differences, but including their differences. Nobody wants to be tolerated or pitied at work. People with disabilities, like those without disabilities, want to be recognized for their talents and accomplishments. In the workplace, this means taking special care not to disadvantage certain individuals. Workplace environments can be inherently biased toward those who do not have disabilities. This means that considering 1 in every 4 people has a disability, visible or invisible, inclusion techniques help a significant portion of your workforce. Highlights from the module. Disability is a condition that severely restricts one or more major living activities. There are 3 traditional disabilities known as sensory disabilities. Hearing impairment is the inability to hear any sound from one or both ears. Ableism is discrimination against people with disabilities. Disability inclusion includes establishing an inclusive workplace where people feel comfortable. Thank you.